Today we're going to be talking about sacroiliac joint dysfunction, also known as SI joint dysfunction. SI joint basically connects your hips to your low back. We see this almost 90% of the time in our office. What causes this are things that we do every day in our lives. So sitting for long periods of time, sitting on a wallet, having babies, driving in cars for an extended period of times are typically when we start seeing this happen. Basically what happens is a joint will be restricted, causing inflammation in the area, and once that inflammation occurs, it causes a cascading effects of different issues, such as IT band syndrome, which is pain down the leg, gluteal tendinopathy, and low back pain as well. So what happens in patients when they come into our office and we know it's a SI joint dysfunction is they'll see a couple of things that really kind of perk our ears. First of all, pain arising from bed. Getting out of bed, patients will say that they have low back pain a little slightly to the right or to the left of their center line, and then slightly above the belt line, and it's almost a pinpoint area where they feel pain. Typically when a patient walks around 30 minutes or moves their body, the pain kind of goes away and the patient feels good with movement. It's a lack of movement which causes the pain to come back, such as getting into the car and driving 45 minutes, and then arising from the car will cause pain in that area as well. Also, when a patient mentions that they have pain going into their buttocks around the glute medius muscles in particular, it's a pelvic stabilizer. So when the pelvis isn't stable, the glute medius are working overtime to kind of balance that pelvis out. So we'll see 10 trigger points in that area as well. Treatment for SI joint dysfunction is very simple. It's usually an adjustment to the low back along with some muscle care. Those two have to go together. When we have a patient, typically what we'll do is we'll kind of lay them on a table, put some hot hydrocolloid packs on them, which will warm up the tissues. We'll get their pelvic balance using some SOT blocks. If it's really far off, if one leg is shorter than the other or longer than the other, make sure they're nice and balanced. And then we do a diversified adjustment to the pelvis. Time frame for fixing the issue of SI joint pain could be something within an immediate adjustment. Patients will get adjusted and immediately start feeling better. It could take 1 to 2 weeks of treatment, which is looking at maybe 3 times a week initially for the first 2 weeks, then maybe 2 times a week for thereafter, depending on how well they're stabilizing. It really depends on what the person does for a living and how they live their life. Someone who's sitting at a desk all day, it's going to take a little bit longer. Also, patient compliance at home. If they're going to do the exercises that we're having them do, or the stretching, working together with conjunction with massage is going to be huge to get rid of those trigger points. Reactivating the glute medius and the glutes overall to support the pelvis is going to be very helpful. Everyone's different. That's the biggest key thing here. The biggest problem that we find with SI joint dysfunction and with patients is that we get the pain down below a threshold where you're not feeling pain. The hardest part is that once people have no pain, they think the problem is fixed, and that's not true. It's just meaning you're not having any pain. You're having a problem over a long period of time, and eventually you do something wrong where it crosses over that threshold and you have pain. So it really takes a lot of effort on the patient's end, on their home care, to really make sure this doesn't come back.